Children who receive a flu shot are less likely to suffer symptoms from a COVID-19 infection. A new study from the University of Missouri School of Medicine shows a flu shot may help protect children against the effects of COVID-19.
Generally, I saw in the clinics and in the hospital that patients who were vaccinated did better generally, so I decided to collect data on them.
Dr. Anjali Patwardhan is a pediatric rheumatologist at MU Healthcare. She reviewed the charts of more than 900 patients, 20 years old and younger, who were diagnosed with COVID-19. She found that the patients who had received a flu vaccine in the current flu season had lower odds of experiencing COVID-19 symptoms, respiratory problems, and severe disease.
Odds of having a symptomatic disease was less in children who had a flu vaccination.
Patwardhan says this may be due to a phenomenon called viral interference, when the growth of a new virus is inhibited by a previous viral infection. This can occur when the first virus invader is an inactivated virus, like the flu vaccine. While more research is needed to see if other factors are at play, the data suggests the flu vaccine offers a possible advantage. Other types of vaccines may also give what the investigators of a different study call trained immunity. Last September, before the COVID-19 vaccines were available, some St. Louis healthcare workers chose to participate in an international clinical trial on the Washington University Medical Campus. Investigators wanted to see if the frontline healthcare workers receiving the vaccine for measles, mumps, and rubella, the MMR vaccine, would have a strengthened immune response to viral infections, protecting them from COVID-19. If so, for how long? Dr. Michael Avedon is principal investigator and Dr. Mary Politi is co-investigator.
The immunity to the specific viruses of measles, mumps, and rubella lasts a long time, hopefully a lifetime. But to other viruses and other pathogens that you may be exposed to, that immune response is probably months to years. We don't know exactly how long.
If I say to you now, I'm going to run around Forest Park. If I'd been training to run around Forest Park for a few weeks before, I would do much better running around Forest Park now. We've similarly discovered that the immune system of the body actually does well when it's trained to respond to infections. Where we've discovered this in particular is in relation to weakened organisms that are used as vaccines. Fusion proteins on the measles and rubella viruses, especially when they bind to our cells, look really similar structurally to the spike protein of the SARS coronavirus 2, which causes COVID-19. So when we form antibodies to the measles, mumps, and rubella viruses in the vaccine, it is possible that those antibodies might recognize as well the SARS coronavirus 2. So we got really excited about MMR because we think there are two key mechanisms by which the MMR vaccine might help in the fight against this particular coronavirus.
Avedon is leading the COVID-19 Research Outcomes Worldwide Network Collaborative, or CROWN study, investigating the effectiveness of the MMR vaccine as protection against COVID-19. Washington University School of Medicine in St. Louis is the clinical coordinating center for CROWN. Once the new COVID-19 specific vaccines rolled out, recruitment in the U.S., UK, and Canada for the MMR vaccine trials stopped. But investigators continue to enroll participants in other countries in Africa until those countries receive COVID-19 vaccines. The team has also launched a sub-study. They're looking at markers of trained immunity with sub-study participants who receive the MMR vaccine during the trial. They want to know if receiving a live attenuated or weakened vaccine like MMR primes the immune system to be more responsive to other vaccines as well as other viruses.
If this trained immunity works with the MMR vaccine and you give it to somebody who doesn't generally mount a brisk immune response, and then a month later you give them a SARS coronavirus 2 vaccine, that SARS coronavirus 2 vaccine could work better than it would have worked if they hadn't got the MMR vaccine before, because their immune response will be trained by having received the MMR vaccine. The other benefit is that it might bolster your ability to fight infections in general. So, for example, if you get the MMR vaccine, it might not just help you against COVID-19 and SARS coronavirus 2, it might also help you against influenza or respiratory syncytial virus.
Many participants had already received the MMR vaccinations as children, so it was considered safe and worth a shot. Same goes during flu season with the flu vaccine. Flu vaccines are encouraged for possibly more than just protection against flu, even when facing new, fast-spreading variants of COVID-19. And COVID-19 vaccine trials for children are just beginning. Those vaccines may not be approved for all children until early next year.
Whether it's influenza, whether it's measles, mumps, and rubella for children, or chicken pox, or all sorts of other things, please, people must get vaccinated. There's no reason, there is zero reason not to get vaccines that are indicated for you because of COVID-19. That's not true. On the contrary, it is all the more priority to get these vaccines. If you get influenza and COVID-19, that's a big, big problem.